If you've recently had a PRP injection or you're thinking about getting one, this video is for you. Wrong moves after an injection can both decrease the effectiveness and slow down your healing capacity. In this video, I'm going to break down the biggest mistakes people make after a PRP injection and what you should do for the best results. For those who don't know me, my name is Dr. Sonam and I'm an interventional sport medicine doctor. Let's get into breaking down common PRP injection mistakes. Have you ever had a PRP injection of your own? Let us know your experience in the comments below. Number 1, taking anti-inflammatory medications too soon. PRP actually works by inducing an inflammatory process. And what anti-inflammatories can do, like NSAIDs, Advil, naproxen, and so forth, is decrease that inflammatory response. Furthermore, NSAIDs can also inhibit platelet activity. And with PRP, we are looking to concentrate these platelets to inject them into a site to help stimulate a healing response. So when I recommend and counsel patients on receiving PRP injections, I ask them to avoid anti-inflammatories for approximately 1 week before and 1 week after the injection. For people who receive tendon PRP, it can be painful. So in those cases, I recommend Tylenol plus or minus opioids to help with pain in the first few days. And then afterwards, they can consider NSAID use at about 1 week onwards. If you're unsure about medication, ask your doctor before taking it. I commonly have a list of things I ask people to avoid and include prior to their PRP injections. Each physician will have their own personalized protocol for you. Number 2, performing high-intensity activities too soon. Now, after a PRP injection is performed, I warn people not to do high-intensity activity or too much activity too soon to avoid flaring up the area. Because PRP is a natural form of treatment, it will take a little bit longer to see the benefits when compared to a cortisone shot. Now, my recommendations will change depending on whether or not this is a tendon or a joint. So with joint PRP, they tend not to be very painful and patients actually well tolerate the injection. I usually recommend them take 3 to 4 days off and then increase gentle walking, gentle cycling, and then strength training week 2, week 3 after. Usually I recommend avoiding high impact activity until week 3 onwards, and then as they feel better, activity is tolerated. A tendon is slightly different because mainly we are using PRP to inject into a diseased or weakened tendon, one with a tear, one with tendinosis or wear and tear. With these patients, they tend to have a lot more pain after the injection, so I really do ask them to rest. I give them some pain medication to go home with as well. And then after about the first week, really promote gentle range of motion and then gentle strengthening. I really let people know that these tendons need to be strengthened from the ground up. So gentle isometrics first, and then work on concentrics and eccentrics. As they start to feel stronger, they can increase the load, but really move slowly to avoid any flare-up or any further irritation to the area. All in all, make sure that you ask your doctor about your post-injection protocol. It will differ depending on what joint, what tendon, and what area we treat. Number 3, applying ice and heat too soon. So with both ice and heat, I do recommend that patients avoid applying either of those for the first 48 hours after the injection. And the reason changes for each one. In terms of ice is an anti-inflammatory, and PRP essentially works by creating an inflammatory process. So if you apply ice on the area, you're essentially blunting that process. So I ask patients to hold off and do not ice the area for about 2 days. Now with heat can increase inflammation, but also increase swelling and pain. And that is the reason why I ask people to avoid applying heat to the area, saunas, hot tubs, bathtubs for the first 48 hours as well. Now, after 48 hours, if someone wants to use something, I err on the side of using ice more so than heat because heat really does flare up both pain and swelling. If you aren't sure, make sure to ask your physician. Number 4, expecting immediate results after an injection. PRP is not cortisone, meaning that it will not work in the first few days after the injection. Because it uses your body's own natural healing factors, results take many weeks to months to come to fruition. So on average, I warn people to wait approximately 6 to 8 weeks to see full benefits, and in upwards of 3 months to see full effect. Now, if you're finding at about the 2 to 3 month mark, you're not noticing much for an improvement, I do recommend that you follow up with your physician to see whether or not you had a partial response, a full response, or no response at all. Depending on your response, we can discuss repeat injections or whether or not there are other options available to you. And remember, if you feel a temporary flare-up after your PRP injection, that is normal. Give it time, trust the process, and in many cases, this settles down before the healing settles in. Number 5, not supporting your healing with proper nutrition. Now, PRP is a signal to help heal. However, if you don't have healthy building blocks to heal the tissues around it, it can blunt your healing response and not give you the most effective treatment for you. Now, what does that mean? It is important to help prioritize healthy fats, healthy proteins, healthy carbohydrates, as well as good, adequate water intake and hydration. This is all important. If you think about it like a construction site, PRP is the signal to start building. However, without the proper supplies, you can't get the job done. Number 6, getting repeat PRP injections too soon. So as we discussed before, PRP takes some time to start seeing benefits. And if you do too many injections too soon in succession, you can actually stimulate the area to be more inflamed, but not really change the healing response. PRP injections can be quite costly, so it is important to be able to balance the risk of doing too many too soon to having just the right number. Some protocols will talk about doing a series of 2 to 3 injections over a 6-week time course. However, some patients may be great with just a single injection. Each of these is individualized, so I highly encourage you to talk to your doctor about your responses to see whether or not one injection versus a few more will be beneficial for you. Trust the process. More injections won't speed things up if your body is still healing. Now that you know what not to do after your PRP injection, you are set up for the best results. If you found this information helpful, hit the like button and subscribe for more sport medicine contents. And let me know down below, what area are you getting treated with PRP and how has your response been so far? If you're interested in my pre and post injection PRP video protocols, I will link them down below. For now, that's all.